Dr. Jane Ruth Acheng and other stakeholders, it was revealed that 7 suspected Ebola patients are believed to have escaped from Mubende Hospital, where they were being monitored.
Some of the contacts escaped from the hospital and decided to go and associate with our people in the society.
Today, the officials from Mubende district have started the hunt for the suspects. According to Kellen Besige, the head of the health committee in Mubende, they have already acquired the names of the suspects. Besige says they have heavily deployed people to investigate the cases.
We have decided to get a list from the hospital and the villages where they came from. We have already started, the first group has gone to get all those contacts.
According to the district health officials, they have embarked on an exercise to sensitize the masses to avoid acts of escaping.
We have even got people, the counselors, the trained ones, to go to the hospital and help our patients. They should be taken through whatever is going on.
At the moment, the Ebola death toll in Uganda has now risen to 21 people as further investigations continue.
On Tuesday, the ministry announced an Ebola outbreak in Mubende district, an issue to date that has continued to cause worry among many as cases continue to rise. Currently, there are 31 confirmed and suspected cases, a sharp spike from the 7 cases registered on Tuesday when the outbreak was confirmed. The total confirmed and suspected Ebola death has also increased exponentially from 1 to 19. According to Uganda Medical Association, government should work on paying the medical workers who were on the front line during the COVID-19 pandemic if they are to face the Ebola pandemic.
As we all know, our health workers who worked in COVID-19, when they did a great job, our dear heroes, they were definitely sacked. And now we have a stampede. And we are saying, can't we have this health workforce reinstated? We have 2,000 unemployed doctors in the streets. And yet when you go to Mubende, you have less than 40 doctors. Less than 40 doctors, including the medical director.
Oledo has urged medical personnel not to risk their lives by reaching out to highly suspected Ebola cases without the right protection gear.
We shall not be able to entertain health workers to touch patients without PPEs. Please, you have a mandate. You have a right to stay home if you're being coerced to work on patients without personal protective gears. And the personal protective gears should be fully braced from head to toe.
He has also called out to the government to supply them with the necessary equipment.
And as Uganda Medical Association, we are saying, government should come up and be very solid on this. Let's have resources allocated for this. If there are not resources available and at all levels, let all the hospitals have now the PPEs available. Because we are seeing cases going nationwide.
The association has also condemned the act of replacing medical directors in various hospitals to those that did humanities.
We've had these issues with the government parastatals which are managed by people other than health workers. Actually, our recommendation is we should have the government parastatal top leaderships led by doctors. Because doctors are truthful and are honest. They will appropriate the resources well. So please, let no one in humanities encroach the field that they have no knowledge of. The medical directors to be individuals of medical background is to help mitigate medical issues when they arise.
One can contact the disease through contact with blood, secretions, organs, or other bodily fluid of infected animals such as fruit bats and other wild animals. The known symptoms of Ebola include high blood temperatures, fatigue, chest pain, diarrhea, vomiting, unexpected bleeding, and yellowing of eyes.
Well, just like we watched, the Uganda Medical Association and their president, Dr. Samuel, is emphasizing that the Ministry of Health does their part to start with pay, all the money that they needed to pay to the COVID-19 task force that they haven't paid at the moment, and also re-emphasized that no health worker should be able, to risk their lives if they don't have the PPEs that are necessary, and called on the Ministry of Health to also still do their part and distribute the PPEs, because if you want the medical workers to do their job, there is no way they're going to do it if they are lacking in any way, if the PPEs are not distributed. So yes, that is something I felt I needed to re-echo. But at the moment, we are joined by Mr. Jackson Kadumye, and he's the Senior Communications Officer from the Ministry of Health and is in Mubende District at the moment. Good morning, Mr. Kadumye.
Good morning.
Good morning, sir.
Good morning to you.
I think we have an issue with, we are still trying to connect with him. Mr. Kadumye, good morning.
Good morning to you.
Thanks for joining us on Sunrise at Sea this morning. Now, I would like to know from you, what's the latest in Mubende District as far as the Ebola cases are concerned?
Oh, thank you very much. My name is Jackson Kadumye, Senior Communications Officer. Right now, I'm in Mubende District, as we are trying to see how we can stop this Ebola from spreading to other districts of Uganda. I'm handling the field of this communication, and so far the updates which we have right now is that we have 34 cases, and on these 34 cases, 21 cases or 21 people have died so far. Out of these 20 people, 4 are the ones which are confirmed because they died in health facilities, and the 17 are the probable deaths who died in communities. And we are still trying to see really what happened before they are dead. But the 4 are the ones which have been confirmed so far that it was Ebola. The cases which currently on admission, we have 30. 17 are the ones which are suspected, and the 13 are the ones which have been confirmed. Those are the cases currently we have on admission. However, on case patients confirmed and probable, you find out that 62% are female, 30% are male. That means the Ebola virus now is more in female than male, but that doesn't mean that men doesn't have or does not get the virus. The bad news now in Mubende or in the country is that so far 2 other districts have also got cases. That is Kyegegwa and Kasanda. They have also registered cases. Kyegegwa have registered 3, and the Kasanda have registered 1. But when we look at these people who were confirmed positive, those who in Kyegegwa participated in the burial of one of their relatives who died out of Ebola, and they buried in Kyegegwa, and the one in Kasanda, he also came to Mubende for burial of the relative in Madudu who died from Ebola, and they went back. He also got signs and symptoms, and then had confirmed positive. What are we trying to bring out as public health actions taken? So far, as Minister of Health, over the weekend, was Monday, so far we had a meeting with Honorable Minister General Acheng, had on Saturday, with the district task force and the other partners. We have so many partners who are coming out to help: the African CDC, World Health Organization, BELA, USAID, AFNET. So many organizations were here, and we had a meeting in the council hall with district leadership and even other leaders from the lower local governments and even the VHTs. There are so many ideas which came out, and so many resolutions which were agreed to be done to ensure that we don't allow Ebola to spread to other districts of Uganda. And so far right now, we have a team from the ministry, from different pillars, we are all in Mubende, and we are always having everyday meetings with the DT chaired by the deputy RDC, and we always monitor the situation. But when it goes to surveillance, the active search in communities of Mubende and the surrounding district is still ongoing to ensure that the teams can get all those people who are connected to those who have been tested positive of Ebola virus. And so far, the team has been beefed up with different support from different partners. And we know that at least we shall be able to get all those contacts. We are using the system of the VHTs to help us in ensuring that they alert us to who is a contact of the person who had Ebola virus. Case management, doctors we have are also handling.
Well, you have given us an update, but at the moment we do understand that 7 suspects, escaped from Mubende Referral Hospital. So have those suspects been, got at the moment? Is there any information?
Yes, we are still trying to see how we can get them. This was an outbreak. Nobody knew that it would be like this. When we are just starting, there are so many challenges which come out, but you have joined as a team. We are working as a team to ensure that we get all those people coming back. And we are trying to inform the public that it's better be handled by the health workers, the earlier the better. So these people,
I can't hear anything.
Hey, sorry. Are you getting now? Hello.
Yes, I can hear.
Are you getting me now?
Because now how do we?
Hello.
Yes, we can hear you, Mr. Jackson.
Yes, I've been saying that we are working as a team. We have the DPC, we have security forces, and even other partners, and even the VHT system to monitor those people. And we know that we shall get them back.
Okay, now I would like to ascertain, have the authorities in Mubende district really banned events and all social gatherings?
No, not at all. Actually, we are just wanting them to be cautious when they are going into such kind of engagements. Even when Mr. was on Saturday, it made clear that we have not banned anything. The business are continuing, though we are warning our people that we have dealers in the area, so they should always take SOPs seriously. We encourage them to wash their hands always, and we always encourage them not to go to gatherings. But we have not yet banned anything because we know that people are just recovering from the COVID-19. They're just trying to start their businesses. So the government and the ministry is not yet done such kind of announcement. But the minister warned that if the situation goes worse and if we get more cases, it may call for some actions which may try to limit some people's movement. So that's the update. We have not yet banned anything as a ministry.
Okay, so Mr. Jackson, looking at also the situation that is happening in Mubende, but also looking at the different information that is being released by the Ministry of Health, do you think a probable lockdown is something that we are going to head into if the Ebola outbreak is not contained?
What always normally when it comes to such kind of outbreaks, we may not close the whole country, but we can close the sub-county where the virus is, and then we monitor the population in the sub-county. But we know that the economy is just recovering from COVID-19 effects. We may go into partial, but right now the cases we have and the situation the way it is, we have not yet gone into that. So we want people to remain calm, let do their businesses, but with the precautions and SOPs everywhere.
Mr. Jackson, now the Uganda Medical Association has asked all health workers without the personal protective equipment, to desist from going to any health centers or even Mubende Regional Referral Hospital. So as As the Ministry of Health, what is being done to ensure that, all health officials and medical workers have the necessary PPEs to be able, to curb this Ebola outbreak?
Yes, we had that issue coming out on Saturday when I was here, but we have partners who are going to provide us with those, and we know that each and every health worker who will be handling the cases of Ebola are going to be protected. We need these health workers at our soil because we cannot let them just go like that, and we are making sure that we give them the necessary PPEs. The problem is that by the time this came out last week, we just had to get what was in the store. But we have done enough effort to ensure that we produce more and we buy more, and we know that this is going to be handled. We know that it's going to be handled. We cannot just allow our health workers to work when they don't have PPEs. No one can allow that.
Okay, yes, now the case that has been confirmed in Kyegegwa district and one in Kasanda, what measures are being put in place to ensure that, they do not spread it to other people in those regions or areas?
Now, the cases which have been confirmed in Kyegegwa, we are working with the UNHCR to ensure that Kyegegwa is taken as a special case because they have refugees, and we are in a good relationship with the UNHCR to ensure that we protect that population. We have put some isolation centers there too in Kyegegwa to ensure that we get all the contacts of the people and we manage them from there. Kasanda is in the Mubende, and the confirmed case is in Mubende Regional Referral Hospital, and we hope that they are going to manage it from there. And even to add that, the way I started from Madu, the minister ordered to start to have a separate place where they are going to be taken care of before being transported to Mubende Regional Referral Hospital, because we have a fear that if we get the big numbers, then we're not able to manage them from Regional Referral Hospital. We have partners who give us things to control or to help in getting some kind of medication to people from the county, and we know that we're able to handle such a situation. However, we are appealing to the people of Uganda that we don't need to have so many cases, because even the health system may fail to help us. Let us try to follow best practices and ensure that we control this virus. We know that we can control it because it's not the first time, but we all doing everybody should do his or her own duty or work or responsibility to ensure that Ebola doesn't spread to other areas of the history of Uganda. And we know that we manage because we have managed Ebola. What they need to know or to do is to ensure that they we see as the ministry and then try to be able to do this virus.
Okay. Now let's take a look at the fact that a certain section of people, not just in the health ministry, but also the public at large, have felt like when it comes to private facilities, they are a bit not vigilant. And these remarks came in from Dr. Chobe, who is the Deputy Director of Uganda National Institute of Public Health, as well as Dr. Issa Makumbi, who say that the 24 male that died in Mubende district had already visited several private hospitals that were not vigilant, and thus the outbreak, that cases increasing in Mubende. So would you say that private hospitals are not doing enough when it comes to vigilancy in the Ebola outbreak, and what is the Ministry of Health doing as well?
Yes, we know that we have different private facilities which are trying to handle the system, but we are always encouraging them to ensure that they become vigilant. Right now, our messages we are passing, we are telling them that if they get any suspect who's having the symptoms of Ebola, let them not handle, let them refer to Mubende Regional Referral Hospital. Actually, in Mubende, we have even given them the telephone contact they should call. They should allow the person to sit on the border to be taken to Mubende, because in between, the virus may spread. But we do have established the system which has enough ambulances to go and pick all those people who are suspected to be having Ebola virus. Right now, we are trying to see how we're going to meet them, and we have passed messages, and even the population, we are telling them that Ebola is not treated in private health facilities. It can only be treated in government facilities, which is now Mubende Regional Referral Hospital. So that's the message so far now we are giving. and we know that even health workers, they know how serious this disease is.
Now, we do see that there's a probable case. Now, this is information that has been circulating on social media, and it says a probable case of Ebola virus disease identified in Kansanda by medical workers. And of course, like I mentioned earlier, the analysis of the sample is going through an examination at the Uganda Virus Research Institute. So do we have any cases of Ebola in Kampala at the moment as we speak?
We have not yet confirmed that because we always get the update daily at 3.
Okay, yes, we have a connection problem at the moment, but we are still, you know, continuing the conversation on the Ebola outbreak in Uganda. But I would love to get his final remarks, much as we still have a connection problem. Mr. Jackson, can you hear me? Okay, so unfortunately we weren't able to get the final remarks from Mr. Jackson Kadumye, and that is a senior communication officer at the Ministry of Health. He's in Mubende district at the moment, so he's been giving us updates on what is happening on ground in Mubende district. Mr. Jackson, could you give us your final remarks?
My final remarks is that we appeal to the public